Good day everyone, I am Charles Derek Mancao and together with Group 5 we welcome you to our video lecture on common sexually transmitted diseases or STDs. Today, we'll be exploring various STDs, their symptoms, complications, treatments, and prevention methods. Understanding these diseases is crucial for maintaining sexual health and preventing the spread of infections. Let's start with chlamydia, which is caused by bacterium Chlamydia trachomatis. This is one of the most common sexually transmitted diseases, particularly among young people. A significant challenge with chlamydia is its often asymptomatic nature, meaning many individuals may not know they are infected and continue to spread the infection unknowingly. When symptoms do appear, they typically include genital discharge and pain during urination. In women, untreated chlamydia can progress to pelvic inflammatory disease or PID, a serious condition that can result in infertility. PID can cause permanent damage to the fallopian tubes, uterus, and surrounding tissues, leading to chronic pelvic pain and ectopic pregnancies. In men, chlamydia can cause urethritis and epididymitis, which can also lead to fertility issues if left untreated. Fortunately, chlamydia is easily treatable with antibiotics, making early detection and treatment crucial. Regular screening is particularly important for sexually active individuals under the age of 25, who are at a higher risk for infection. Health professionals recommend annual screening for this age group as well as for older women with risk factors such as new or multiple sex partners. Early treatment not only prevents complications but also stops the spread of the disease to sexual partners. Public health campaigns emphasize the importance of routine screenings, safe sex practices, and open communication with the healthcare providers to manage and reduce the incidence of chlamydia. Next we have is gonorrhea, another bacterial infection caused by Neisseria gonorrhea. This infection shares similarities with chlamydia in that it can be often asymptomatic, meaning many people may not realize they are infected and can unknowingly spread the disease. When symptoms do appear, they commonly include genital discharge and pain during urination, but they can also extend to other areas causing painful bowel movements or even sore throats if the infection is oral. The consequences of untreated gonorrhea are severe. It can lead to PID or pelvic inflammatory disease in women, which in turn can cause chronic pain and infertility. In men, gonorrhea can result in epididymitis, a painful condition of the ducts attached to the testicles, which can also lead to infertility. Furthermore, the presence of gonorrhea increases an individual's susceptibility to contracting HIV due to the compromised mucosal integrity. Treating typically involves antibiotics, but the rise of antibiotic-resistant strains of gonorrhea is a growing concern. This resistance makes it more critical than ever to adhere strictly to prescribed medications and follow up with medical health care providers to confirm that the infection has been completely eradicated. Failure to do so not only endangers the health of the infected individual, but also perpetuates the spread of more resistant strains. Next, we have syphilis, which is caused by the bacterium Treponema pallidum and progresses through distinct stages, each with characteristic symptoms. The first stage, known as primary syphilis, features a single sore or multiple sores at the infection site, which are typically firm, round, and painless. If left untreated, the infection advances to secondary syphilis, marked by skin rashes and mucous membrane lesions. These rashes often appear on the palms of the hands and soles of the feet, but can occur elsewhere on the body. Without treatment, syphilis can enter a latent phase, where symptoms are not visible but the bacterium remains in the body. This can eventually progress to late-stage syphilis, which can lead to severe damage to the heart, brain, nerves, eyes, and other organs, potentially resulting in death. Fortunately, early-stage syphilis is treatable with antibiotics, usually penicillin, making regular testing and early intervention crucial to prevent these serious long-term effects and halt the spread of the infection. Now, I'd like to pass the lecture to Jenson Alicano, another member of Group 5.
HPV, or human papillomavirus, is a prevalent viral STD often unnoticed due to its asymptomatic nature in many cases. While some strains may manifest as genital warts, others pose a significant risk, linking to cancers like cervical, anal, and throat cancers. Fortunately, vaccination stands as a highly effective preventive measure, recommended for both boys and girls from ages 11 or 12 onwards. Alongside vaccination, routine screenings, such as pap smears for women, play a crucial role in detecting cervical cell changes early, thereby averting cancer development. The HPV vaccine substantially mitigates the risk of HPV-related cancers, underscoring its pivotal role in public health initiatives aimed at curtailing the transmission of this virus and its associated health risks. Genital herpes stems from the herpes simplex virus, or HSV, and manifests itself in two types: HSV1, often linked with oral herpes, and HSV2, which is primarily responsible for genital herpes. Symptoms present as painful blisters and sores in the genital region and nearby areas. Despite lacking a cure, antiviral medications aid in outbreak management and transmission reduction. Crucially, open communication with partners and adherence to safe sex practices are imperative for preventing viral spread. Furthermore, outbreaks can be influenced by diverse factors such as stress, illness, or weakened immunity. Thus, managing herpes entails not only medical intervention but also lifestyle adjustments aimed at minimizing outbreak frequency and severity. Human immunodeficiency virus, or HIV, is the virus that leads to AIDS, or acquired immunodeficiency syndrome. HIV attacks the immune system, making individuals more vulnerable to other infections. Initial symptoms may resemble the flu, but the virus can remain asymptomatic for years. Without treatment, HIV progresses to AIDS, severely compromising the immune system. However, antiretroviral therapy, or ART, is a standard treatment, which involves a combination of HIV medicines taken every day, which helps control the virus and allows individuals to live longer, healthier lives. Safe sex practices and regular testing are key to prevention, as ART not only manages the virus in the infected individuals, but also significantly reduces the risk of transmission to others, contributing to the overall prevention of HIV spread. Trichomoniasis is a parasitic infection caused by Trichomonas vaginalis. Symptoms include genital irritation, discharge, and itching, although many people do not experience these symptoms. The infection increases susceptibility to other STDs. It is treatable with antibiotics, usually metronidazole or tinidazole. Prompt treatment helps prevent complications and transmission. Trichomoniasis can cause discomfort by increasing the risk of other STDs by causing inflammation in the genital area. Regular screening and early treatment are essential to managing and preventing the spread of this infection. Preventing STDs involves several strategies. Number 1, condom use. Consistent and correct use of condoms significantly reduces the risk of most STDs, as they act as a barrier to prevent the exchange of bodily fluids, which is a common route for many STD transmissions. Number 2, vaccinations. Vaccines are available for HPV and hepatitis B, offering effective prevention. They are recommended for preteens, but can also be administered to older individuals who have not been vaccinated. Number 3, regular screening. Routine testing helps in early detection and treatment, preventing complications. Regular screenings are especially important for sexually active individuals and those with multiple partners. Number 4, monogamy. A mutually monogamous relationship with an uninfected partner reduces risk. Reducing the number of sexual partners can significantly lower the chances of contracting an STD. Last, education. Awareness and education about safe sexual practices are crucial. Understanding how STDs are transmitted and the importance of protection can empower individuals to make informed decisions about their sexual health. Untreated STDs can lead to severe health problems, such as infertility, chronic pain, and an increased risk of HIV. Pregnant women with STDs can transmit infections to their infants, causing serious complications. For example, untreated syphilis in pregnant women can lead to stillbirth or severe infant illness. In conclusion, understanding and preventing STDs is essential for maintaining sexual health. Regular screenings, safe sex practices, and open communication with healthcare providers and partners are vital steps in preventing and managing these infections. By staying informed and proactive in addressing sexual health concerns, we can create a healthier future. Thank you for joining us on this lecture on common sexually transmitted diseases. Stay safe and take care of your health.